She got you, girly wig. She got you. Hello, beautifuls. Welcome back to my Chanel, and welcome to another episode of Botched, girlies. The reunion part 2.
Time for a brow lift.
Well. The last episode of Botched here on the Chanel is weirdly one of the most highly commented on videos on my Chanel. It seems people have a lot of opinions about things that go on Botched. Some good, some bad, and some just people want to share their experiences with things.
Oh, that's nice.
I have a few things I'd like to talk about before we start today's episode. Firstly, I think some people got a little bit misconstrued about my opinions on puberty blockers for trans teens. I am of the opinion that puberty blockers are the best start for medical transition. Categorically, my lovelies. I personally believe that HRT should come afterwards, many years later. And when I also mentioned about taking breaks between surgeries, it's because fat redistribution and HRT take time to affect the body. Transition is a journey and it looks different for every trans person. So yes, I am pro puberty blockers for trans youth. But more importantly, I am pro healthcare for trans youth. If you take that away, they have nothing. Absolutely nothing. And taking away access to healthcare doesn't solve the issue, it makes it underground. Next, I want to talk about Toby Sheldon, who was the Justin Bieber lookalike. In a very drastic change of events, shall we say, only a couple of months after the previous episode of Botched aired, he was found unalived in his hotel room. For many different reasons. If you want to know the story, you can. It's part of the reason why I didn't actually cover the episode that they were featured on in the series, because I don't know, there's something in my soul that just feels a little bit like we're watching someone go through something on a TV show, going through it, and then they've also lost their life still going through it. It doesn't feel right to sort of speculate on. With that being said, though, my lovelies, I do want to read out one of the top comments from the last episode of Botched, of which there are plenty I could have chosen from, but you know what? I've gone for something controversial yet brave, perhaps. And that is by Ash Chi Cupcack. And they say, when you mentioned if one of Dubrow's kids was trans, apparently almost all of his kids are part of the LGBTQ community, bisexual, lesbian, and trans. Who would have guessed he was such an ally? He truly is a complicated person. I never know how to feel about him. We recently saw Dr. Dubrow on the Vice documentary about the Swan, and he still has this kind of complicated essence around him, even to this day, where, if I'm going to be really blunt about it, I kind of feel like he's in a bit too deep. He's made an entire career about extreme plastic surgery, televised extreme plastic surgery, and I feel like if he really felt remorseful about certain things, I don't even think he would be able to perhaps fully express it because of the nature of reality TV. I truly do not believe you can be 100% honest about your career or how you feel about your career if you are so deeply ingrained in reality TV culture. I don't think like a freedom of truth is really allowed in reality TV.
Cancelled!
Oh, it's getting deep here today, girly wig. And we haven't even started yet. Okay, my lovelies, make sure you're sitting down comfortably. Grab yourself und beverage. Pop your little Ochanger into your surgery hole and let's go. Let's go. Ah, go Bobby. Oh, I want to be sexy. I want to be perfect. I want to serve body oil on the game. She's got gout. Perfection fail. Plastic woman. Did we ever actually hear anyone say, I want to be perfect? Apparently, the intro to this show was written by a contestant. Contestant?
Wheel of brow lift.
What did the Swan call it? Cast member. Cast member. Are you a cast member on Botched? The mystery thickens like rotting milk.
Who wants the cake? Cake, cake, cake.
I'm all dressed up.
Cake?
I'm all dressed up.
Do you want the cake?
Lonely Jim, lonely Jim, lonely Jim.
Up a doon, doon, doon.
Up a doon, doon, doon.
Welcome back to the
A single
Botched
time.
Reunion Show and Tell.
Welcome back,
I'm
Maria
Menounos.
Menounos.
I'm here with Dr. Terry Dubrow and Dr. Paul Nassif.
Hello.
So now, do you guys think that this show will encourage people to look at plastic surgery more maybe than they would before?
Yes.
You know, it's funny. I don't know about you, but I always get asked by other plastic surgeons, are you afraid it's going to turn people off to plastic
It
surgery?
doesn't.
I hope so. I hope it's a
Really?
cautionary tale. Be careful who you choose and what you consider doing, because it's not having your hair and nails done. It's real surgery. It's like brain surgery or cardiac surgery. It's surgery. So pick your doctor and situation.
A complicated moment, because he was on the panel of the Swan in which they were like, yeah, let's give her 21 plastic surgeries, girls. Solve the complications. Let's just see what happens next.
Why aren't you making it to the pageant?
But yet here he is being like, remember to be careful and considerate about the procedures you get. And that to me, what more can you say in a professional manner of like, be very, very mindful, demure about what you want to have done and who you're going to. This decision should be taken over time and not lightly or instantaneously.
You have to have a good eye. In other words, because you can be a fantastic technician, but if you don't have a great eye, or your view of beauty is skewed,
What about your third
then you're going
eye?
to make someone look not great.
Yeah, it's where
Well,
we
I
both have
mean-
great eyes.
Well, Dr.
The irony, of course, is they wouldn't have a show if there wasn't for these surgeons who are taking risks, heavy risks with their patients. And in sort of like an inverse along the line 10 years later, if this show and the way that some of these plastic surgery stories have affected me, if they didn't exist, I wouldn't be here doing this reaction to an older show in which they're kind of reacting to plastic surgery. It's very meta. And not the Facebook kind.
Which one is it on TikTok?
Well, NASA gives good face, and Dr. Terry
Face,
Dubrow
serving
literally
face,
handles
beauty face.
the boobs. With over 40 years of
Serving
surgical
boob,
experience
beauty
between them, their 16-year friendship has blossomed into a botched bromance right before our very
They're gonna
eyes.
get married
Watch
now.
this.
Green cards. Oh, right, here we go. Right into the surgery hole.
Take a look at me.
Right.
Anything different?
I could not be friends, like besties, with a plastic surgeon. It would ruin my mental health. Could you imagine me like, this is Twinkle, what can we do about that? Hello, it's 3 a.m, I know, but have you seen this pocket of fat I'd love to have removed? Can you just bring your little needle over and let's go? Like, no, I couldn't do it. I guess I could kind of be friends in like a way that's like the Real Housewives are all friends with each other. Like, they're just not at all, but they are, if you know what I mean.
I've had enough of you, you beast. Beast.
Besides that, and I haven't. I look good. Terry and I are very close. Very, very good friends. We get along very well.
Maybe I should catch. You be the pitcher, I'll be the catcher.
And
Are
you
you
know
a
what
breast
that
man?
means, don't you?
I don't think he is. He's been very calm through this
I
whole
think he's
thing.
a
I don't
breast
think
man.
he is.
Now, from a personal standpoint, I'm more of a button leg man.
Right hand,
Okay.
left.
Oh,
shoulder,
I am
shoulder.
Madonna.
You're a star.
He has the white man syndrome when it comes to
Ballroom is
dancing.
incredibly
rhythm.
angry. Bingly bong, twink
welcome.
delivery.
Thank you.
Hi. I had a bunch of thoughts running through my head. Number one, I want to kill Terry. Probably having a porno upstairs or something.
Oh, is this
Probably
Justin's
just laying out
house?
at the pool. I knew this was the wrong thing to do. And what are we doing? What's going on in this house that there's someone answering the door in his underwear?
Are those underwear?
I mean, that's
just laying
It
out.
looked like underwear to me. These had
that
that
is-
thing in the
I mean,
front.
it's very ostentatious and gauche, but that is a beautiful house. But I guess it's TV magic, isn't it? Really? But I couldn't answer my door in the under. I'd need a robe. You know, one of those robes where you're like, I'm very wealthy and my husband died under mysterious circumstances. One of those robes.
Do you know where you have to go?
I didn't look
To the
that
bathroom.
closely.
I swear I'm watching a buddy comedy. You guys are too much together. But Terry, I
Oh,
have
you're
to say,
doing
do
them
give
nice.
Paul Hart.
Too much. Right, we've got
Dr.
some
Dubrow,
zeets,
what's
as
the
they say.
youngest age you would consider putting in breast implants?
Oh my god.
In general, I like to wait till they're at least 21, till the breasts are mostly done growing.
Okay.
But if there's a deformity, for example, there's a syndrome called Poland syndrome where one breast doesn't form at all and the other forms normally.
Wow.
Then I would consider putting in much earlier because they may be teased or really uncomfortable. So 21 typically.
Have you guys had any like epic fails?
We've all had.
Look, we are surgeons. We are extremely busy surgeons. There are risks and complications associated with surgery. If a surgeon's told you he's never had an infection, bleeding, scarring, a problem, that just means he's a non-operative surgeon.
Yeah, he hasn't
Part
done
and
anything.
parcel of being a surgeon is dealing with complications. So yeah, we've had problems.
Yes, I will actually say here, that's nice to hear in a way. I mean, obviously it's not nice for the patient that goes through something as traumatic as like a surgery going wrong, but it is so important to hear that the professionals you're going to know how to deal with something if it goes wrong. That to me is like how you define a professional. Anyone can do anything. You could go to your best mate and they can build a computer. I wouldn't consider them like a professional until they've encountered a problem that they can go, oh, I've done this and I actually know what the problem is in order to fix it. Does that make any sense? Professionals are only really worth their weight in gold when they know how to fix an error. To start following something from start to finish is instructions. You could technically build your own car from scratch if you just followed instructions. A professional would know certain things to do and certain steps to make and certain ways of fixing things that go wrong. She's got a B-Tech.
Also a lot of pressure for you guys when
I
you're
also do
performing
cast a
these surgeries on people who it could go bad. Their noses are so delicate at this point. Are you guys scared doing this with cameras on you?
You know, when we're in surgery, we're not even thinking about the cameras. We're focused on what we're doing. And I have to tell you, I don't even think a second about it.
You go into this sort of surgical doctor mode where it's here, it's now, do it right.
What's it like performing surgery, having another doctor looking over your shoulder?
I love operating together. I think we're both plastic surgeons, we're both board certified, but we have a little bit different background. So when you bring those two heads together, you tend to get an additive result.
Because we both can throw out different ideas, because there's sometimes many ways to do one procedure.
Yes.
And, you know, two heads sometimes are better than one.
Yeah.
What's that famous phrase? Lots of ways to fit a baby in a kettle. No.
Who's getting more Twitter followers?
Well, if you don't include the ones he's purchased.
First of all, I think I do have more.
Have you heard there's another billionaire looking to buy Twitter? Wouldn't that be like nice? Apparently he wants to restore order.
Once more, the Sith will rule the galaxy.
You do.
That's one thing I have. My
you
goodness.
do, but we had the same number of Instagram followers when the show started, and now you have, I just looked, 14,000, and I have 71,000. So, I don't know. What does that mean?
But you constantly always taking photos.
I never
That's
do.
wild. I have almost as many followers as Dr. Dubrow back in 2014. That's alarming, isn't it?
I never do. You take them all the time. I haven't posted a photo on Instagram in like 3 months.
Right.
And you post them daily of your wrinkles and your muscles.
You guys are like a married couple.
Yeah.
Why is that a problem?
Let's take a break. When we return,
Do you know, there is something very interesting when older people talk about modern technology. It's almost as if it's like cringe to them to use it in a way that, like, that little bickering backwards and forwards there is like, well, I have more followers than you on my Instagram. I don't even post. So you're not actively using the platform, but you're still also boasting about using the platform. There was at one point, this is entirely off kilter, there was a discussion happening in Congress, and it was about like digital social media and technology. There was something about like, was it Android or iPhone? Some like dubious settings that could be used to like snatch data. And because everyone in the discussion who was considered like the professional was a dinosaur, to put it nicely, one of them said something and they all sort of like nodded in agreement. And it was something along the lines of, oh, well, I don't even use iPhone. I've still got a phone without the internet on. And it's like, so why are you here then on a hearing about actually important modern technology if you are actively refusing to use it or engage with it? Bitch! What is your value here if you do not use it? It's very strange when dinosaurs take pride in not using the tech that they are legislating on. Do you know what I do when I don't know something? Shut up and listen to the people who do. I want to be perfect, girls.
Welcome back to the Botched
Reunion
Show and Tell.
I'm
Marina Munoz, and I'm here with Dr. Terry Dubrow and Dr. Paul Nassif.
Yes.
Joining us in the studio now is some of the toughest patients these doctors have had to face this season.
Lots
Welcome,
of
Michelle
trans women
Blackwell.
on this show. I love it.
I see your nose has not fallen off, which is good news.
No.
How are you doing?
I'm good. Thanks. I just, you know,
Did we see
I can
Michelle?
breathe.
This is a good thing.
This is a good thing. This is a good thing.
The lovely and talented Monique Allen is also here. And I can't stop singing your song. I don't know why it's not on the radio. And Miss Desiree White, you're looking good. You feeling good?
I feel wonderful. So fabulous. Thank you for having me.
Well, let's start off with
That's
you,
really
Paul.
sweet.
What
Everyone's
makes
got
a
nice shoes,
patient
not a hateful
a
shoe in
difficult
sight.
case?
The part that makes it difficult after you do the surgery is expectation, especially when you're doing a very complex case and the stakes are high for complications, and then immediately they, you know, expect perfection.
You're talking specific. You might as well have said Michelle. You just said that.
Right.
Yeah, because we got into
What
it
was
the
the
first,
situation
what was it,
here?
like the first day?
The very next day after surgery.
She's like, look at my nostrils are a little bit uneven. I'm going, my God, I just rebuilt your nose for like 9-10 hours. So now I look at Michelle and I see a nasal piercing.
I was gonna ask
What the hell are you
about
doing? You got to take that out.
Oh, it's fine.
Oh, is it fake? Oh, she got you, girly wig. She got you.
I was going, oh my God, right in the middle of my ear grab. You got me. You got me.
Oh my goodness. So Terry, what's worse, a patient who has a challenging personality or a patient with a challenging surgery?
I find a challenging personality the most difficult because you depend upon them
just say Janice.
to have a realistic set of expectations and to follow instructions.
That's the hardest part, isn't it? The hardest part, and quite a cautionary tale we've seen throughout this show. Be realistic and follow instructions. I don't know why, but a lot of people just seem physically incapable of doing these very two things after having such serious things as cosmetic surgery. Follow your aftercare. Don't rip your drains out. Make sure you change your wound dressing. Take some rest.
Own a business, bitch. Suck a dick.
What is this?
You want tummy tucks, nasty noses, and difficult divas who refuse to follow doctors' orders. That is just a sampling of the challenges our doctors face this season on Botched. These were the patients who tested the patients of Dr. Dubrow and Dr. Nassif.
What's this bit?
These were the tough cases.
Bit deeper.
Telling your doctor the truth is always a good idea.
But you have free liquid silicone injected everywhere.
That's right.
Every woman, every bitch walking around the streets here is full of something.
Where did you have it injected?
Well, I had it in Tijuana.
She talks so
fact that
like...
it's
I can see why my ex was like,
Cosmetic surgery doesn't make it different from any other type of surgery. Cardiac surgery or brain tumor surgery, and like any other surgery, it can and does go bad.
Yeah.
I think she has a very complicated cosmetic surgery history.
Can I just interrupt you for a second? Every patient we see, you always tell me, they're all complicated, my goodness.
I don't like you.
Clocked.
Well, you're already starting to complaining early in the morning. Wow.
I show you this would be a porn. This is not porn.
Oh dear. Oh, she's so
A
off
little
her face
something
on meds.
there.
That's a bit
Michelle, you
mean.
finally have a nose lucky number 7. How do you feel when you look in the mirror
A
now?
nose like the number
I have
7,
one
like
complaint.
7.
Look, here I go.
Oh.
I do.
Look at Terry's face.
You didn't listen to me
About what?
when I said this one was reshaped and this one wasn't. So if you would have listened to me and reshaped it, it would be perfect.
Okay, when you've had that many surgeries and your tissue is destroyed, and even though we tweaked it even after, I'm ecstatic with your results.
So you had another session after the one we saw on TV?
She had a little tweak on one of the nostrils.
And it's still not fixed, but it looks better than it did before.
Let's take a peek at what Dr. Nassif actually
Ooh.
fixed. Yeah, I think the after is gorgeous.
That's a home run.
That's a third base.
It is not a triple. I'll tell you why. It would be a triple if your starting point was normal. It was so abnormal. It's a grand slam home run.
Well, we have some Twitter questions we're going to go to.
A single clap in the background. That's kind of difficult to see, isn't it? So throughout this series, I have, in order to cut down some of the timings of these episodes, because if I reacted to every single one, these episodes would each be an hour and a half each, and that is a lot of editing for mummy to do. Interesting there that we have seen some drama about someone having kind of unrealistic expectations about a revision surgery. However, I also said the same thing about Kimber James. When she had her first result, I was a bit like, oh, I don't know if I would be happy about one of my nostrils looking like this, like a bit misshapen. And there we've seen Michelle kind of express a similar idea. The thing about surgery is, you have to remember about any beauty treatment ever, you're never going to have perfection, only improvement. Even if you are operating on yourself with your own skills and you are the best surgeon in the world, you will only ever achieve optimum improvement and not perfection.
Your fave could never.
So Elizabeth from Portland tweeted, Dr.
Elizabeth.
Nassif, several times we've seen you take cartilage from a patient's rib and use it to help shape their nose.
Yeah, you can also
Is
take
that
them
the
to ear.
only place you can get cartilage from?
If I need a lot of cartilage, we got to go to the rib. If I need something that's kind of soft and gentle, we can go to the ear. But the number
My
one place
boyfriend has had 3 nose jobs. Mostly reconstructive, actually. And for his second nose job, they took a section of cartilage from his ear. So he has a little scar on the back of his ear, and I think it looks really cute.
go to is inside the nose called the septum. But when you go to someone who's had 2, 3, 4 surgeries, there's never cartilage there. It's already been used.
Wait, so with that rib part, that has to be tough to recover from because I've cracked my ribs. That's painful.
I felt like I was being murdered. Yeah, it was like, okay, you can't really move. I can't lay this way. Can't lay. It was, you couldn't lay.
You also found when when you went to get part of her rib, you said that they were already starting to calcify.
I feel like I'm dancing with this rib. This rib is calcified. This is not a 40-year-old rib. This is not a 40-year-old rib.
And you perhaps implied that her
That her
saying
ribs
she was
weren't 40 years old.
Was it really 40? Are you saying that she lied about her age?
Yeah, how old are you?
I'm not even 40. That's why I was like, I was told.
You're not even 40?
No. Here's the thing. I was told that you ingest caffeine, it makes you old and it calcifies your bones. My friend who told me, who was a doctor, when he said that, I thought it obviously is true because...
That's not true. It's absolutely ridiculous.
Well, then how do my bones look like I'm 55 and I'm 30-something?
The rib itself was not typical for a 39-ish-year-old.
I'm 35.
How many years have you been 35?
A few.
I'm sorry. I'm sorry, madam. You're not the same age as me. Not the same age as mummy. No. She's turning out to be a very interesting patient, Michelle, because there seems to be a problem with everything. And I often find that when I professionally have dealt with people that find issue with everything, they're quite often the kind of people that will never be able to achieve a result that makes them happy. And in a way, it's kind of like perfectionism, and I touched on this in my last video. I am myself a perfectionist with what I can achieve, which basically leaves me perpetually disappointed with my own work because I know I can always do better, always reach more, always do more. With other people's work, however, that doesn't apply for some reason. I don't demand the utmost 100% perfection from everyone else because logically I know I can get very close to it, but I'm not going to get that. It's very strange. So the idea that this lady has perhaps been mysterious about her age is interesting, but also, do you not have to have ID to have plastic surgery? Maybe that's a new thing. Maybe it's an American thing.
Yeah. I've been there a few, but not 5.
So by the way, you see the relationship?
It's love.
I can give her crap and, just get her in her place and she'll give it right back to me.
You're like my boyfriend. I just tell you whatever I want to say, right? We got it like that.
Have you had more acting jobs since you've got your new nose? Has life changed?
When I would talk to any media, they're like, oh, yeah, you were the cute redhead. I'm like, what? I'm not cute. I'm fly.
Ooh, I
was like, let me show a different side of me. But I'm just putting myself out there more because I have more confidence.
I call that a
So
home
is that
run.
no?
See, it's a third base. No.
Is that just no, but with extra words? Have you got any acting jobs? Well, they always tell me I'm cute and I'm putting myself out there. That to me sounds like a no. Oh, bibbidi boopity boo.
Shut up.
Oh, shut up.
Shut up. Shut up. Everybody.
Busted, just like my ex on your
Hey. Glamorous Monique.
glamorous wig. Everyone, please stand for our national anthem.
Welcome back to the Botched Reunion Show and Tell. I'm Maria Menounos. So
You are.
Monique, how is your singing career going?
Well, thanks to the show, my song, my EP on iTunes is doing really good.
Are you going to do
least
another?
7
Well, I have
views.
five songs on there right now.
5.
38 Triple F, Punch My Kitty, People's Tranny, My Daddy Loves My Plastic, and Oh Dad.
The idea that was not bleeped on TV is crazy to me. The people's tranny. Oh, do you know what? Oh, you've got to laugh, haven't you? If you didn't laugh, you'd just pass away in fear.
Are you a puff?
It was a different time. Oh, gosh, we are a funny lot, aren't we?
Yes, and also no.
Have you done videos for all of those? Punch My
I've
Kitty.
done
and-
videos for 3 of them.
that kitty.
They should be in it. Would you guys ever be in one of her videos?
Just wild.
You guys should
no.
be one.
He'll dance in one of the videos.
We should
He'll be
audition
punching
you
his
right
own
now.
kitty.
He wears a mankini that might be appropriate for one of your videos.
Monique, on the show, you said you had over 200 procedures
That is
since your
wild.
sex reassignment. Do you have more that you're thinking of doing?
I really don't plan on it, but things pop up.
Okay. Now, a lot of
True,
people on
that's
Twitter.
true. I mean, you can be, very level-headed about the amount of plastic surgery you're going to have. Clearly, I think 200 is, perhaps 190 too many. But that is always a good way to be with plastic surgery is you know, I don't want any more, but if something pops up, I might have to have it again. That's how I feel very much with mine. Obviously, I want to have my breast shape different than it is currently because I find them a little bit too bimbo and it's just not for me.
Mary has had surgery on her vagina to gain what she calls the fattest vagina in the world.
And I also have a little bump on the side of my nose here from a bone spur from my rhinoplasty that I want fixed. And that's it. Those are 2 technical plastic surgeries, but they weren't planned. They've just popped up.
We're stunned that you had so many procedures.
Madonna stuns in new wig.
Why so many? I mean, 200's a lot.
Yes.
It's possibly way over 200, honestly. If I want something done, I'll just take care of it.
So doctors, we've seen you turn down patients who've had as many procedures as Monique. So why did you agree to operate on her?
She had some problems. So even if they have a serious psychological problem, if they have a serious bad physical problem and we can help them, we strive to do that.
Okay.
In her case, she was psychologically, she's amazing, but she had a bad physical problem. So
well, Monique, let's take a look at what you look like before your
200 plastic surgeries to me doesn't sound psychologically amazing, but I guess I am a little bit like skewed here because when it comes to medical transition involving surgical procedures, you're gonna likely have to have more than one. Obviously not 200 unless something has gone very, very, very wrong. But a lot of the times when you go through transition, when you change the shape of something or the size of something, everything else has to either fall into harmony or not, depending on your end result, whatever you want. Not every trans person undergoing medical transition has to have every surgery. Quite often it's very pick and choose, because it's about what alleviates your dysphoria and makes you more comfortable in your own self. That's the way that I viewed it, and that's always the way. Any young trans people out there that ever want to know about like plastic surgery, what my opinions are, like what they should and shouldn't have done, I always think, take the time, think for yourself where you really want. Don't get distracted by what other people are saying. Oh, well, I think you should have... Don't listen to them. Do as much or as little as you need to feel comfortable in yourself, as long as you aren't actively taking away from your life. That's what I think about. That's how I think about it. You've got to be kind of sensible about it. It's not a one size fits all, and it's very expensive, and the healing has to be taken into account, and blah, 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 blah. If that's one thing I can instill in my young trans audience out here, is take the time to really think about it. Consider your options first.
Botched surgeries were fixed.
Right, botched lady. Oh yes, the ears.
That looks amazing.
What was the audience there like? Oh, horror.
Dr. Nasser, what do you think was the most challenging part of Monique's surgery?
The part that was preemptively challenging for me mentally is worried that I'm going to encounter a lot of free-floating silicone in the face. And that can cause and pose some big danger. Healing, irregularities, infection.
I will say to young trans people, don't get free-flowing silicone injections. Absolutely not. There is no amount of free-flowing silicone injections that are good for you or a safe level. Just don't do it.
And luckily, it didn't happen.
Is that a safe thing to inject free silicone into a face or into a body?
Not only is it not safe, it's illegal.
It is?
Yeah. It's completely...
Where are you getting that silicone injected?
I had that done in Tijuana, but you can have it done anywhere. I haven't done liquid silicone in years. Anything that I'm encountering now is reconstruction surgery based on the bad results of silicone. I've been deemed medically disabled.
There you go.
I can't walk long distances. I can't do a lot of things.
Wow. So
don't get injectable silicone. Don't do it.
We did an e-online poll where we asked our viewers which difficult botched patient would you rather be stranded on an island with? Desiree, Monique,
horribly
or
invasive
Michelle?
question.
Who do you think won this one?
Of course, it was Michelle.
Monique.
48% chose Desiree.
Oh, well, I don't. Do we know?
Desiree, what do you say to that?
Yes.
That's pretty cool. So Desiree, when you told the doctors that they used ice instead of anesthesia during your botched tummy tuck in Tijuana, I know I couldn't believe it, but apparently a lot of our viewers couldn't either.
They both came in with like a really big block of ice. One of the nurses came and she put it on this side
Where
right
was
here.
This episode?
And then the other girl put the other one here.
Kidding me.
I'm not kidding.
Instead of anesthesia. Okay, that would have been immediately like, I'm leaving, thank you, bye.
You get the hell out of there the minute they brought out that ice.
Exactly.
#human popsicle. So when they told you there wasn't going to be any anesthetic and it was just going to be ice, why didn't you leave?
They spoke Spanish. I could not converse with them. And so I actually thought they were putting the ice on me just to help the anesthesiologist. I really just didn't know. If I had known, then it would have been...
If you can't communicate with your surgeon through an interpreter or through a very trusted scenario, don't do it. There are many different things that you can do to ensure your best rate of success from the surgery that you want in life when it comes to cosmetics. That is, picking a good surgeon, making sure you are accurately describing and communicating your wants and realistic results from that surgery, listening to other people's references about surgeons, like their reviews, their own experiences, and not paying the rock bottom price. You pay for what you get in this world, and nowhere do we ever see it more painfully obvious than with plastic surgery. In this case, I would have said, Desiree, stand up and leave if you cannot communicate what's happening and they can't tell you every step of the way what's about to happen, what you're going to go through, what your aftercare is of this situation. Get out of there. Get out. Get out.
Different if I can, conversate with them and say, okay, what is this ice for?
So they removed the ice and just started slicing you open?
After the doctor came in, and then he spoke English, so I was able to talk to him, and then he told me the anesthesiologist will not be able to make it. Yep. And then he told me that the ice was perfectly fine, that it's going to numb me, I'm not going to feel anything.
Did you feel anything?
Oh, yeah, when he started cutting on me, they had like this sheet above me, and so I'm looking up, so I couldn't see anything that they were doing. Once he started cutting on me and I felt it, I started screaming. I screamed through the whole thing. I don't even know how long it lasted.
She's lucky she survived.
So, Desiree, let's remind everyone.
That is the most shocking plastic surgery story I've ever heard. I don't know which episode her story was in, but we did not see that. I am absolutely gobsmacked. Isn't anesthesia for surgery like on one of the, is it the UN's like top 100 necessary medicines, necessary procedures for like healthcare internationally? Bonkers. If someone says to you, I'm sorry, even the very fact that she could communicate in English with her doctor then, and he was like, oh, the anesthesiologist can't make it. To me, that's like, oh, so we're rescheduling the surgery. It's not, oh, well, do you know what? Just go ahead anyway. That's wild. She might have felt very uncomfortable being in a brand new place, couldn't speak the language. The doctor is trying to take advantage of her, blah, 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 blah. At the end of the day, like, your life is on the line. That fight or flight needs to kick in. But again, it's one of those things, if I really extend my, like, empathy here, it could be one of those things where your self-esteem has been so shattered that even if you find yourself in a scenario like this, you might not even fight for yourself in that situation, which may be what happened here, because like a well-adjusted, well-rounded human wouldn't find themselves in that situation to begin with. So you can't apply like well-rounded, like logical logic to the scenario. Gosh, right, okay, anyway, yeah, right, yes.
Everyone, what you look like with your coochie in the wrong place. Wow. Amazing results. Are you so happy?
I don't know why they keep pulling up these underwear because I actually want to see the scar. The irony, of course, is with a tummy tuck scar, you still see it. It's going to be here. But they take the befores like this. Oh my God, panties on the internet. They take the before like this. This is my appendix out scar. They take the befores like this and they're like, oh yeah, they got this bit. We need to get rid of this bit. And then they just go like this, and they're like, and it's been done! And it's like, yes, but I want to see the scar so I can judge how good the work is. There's no point being a makeup artist and then wearing a veil and going, the makeup's done.
And everything's in the right place now?
Everything's in the right place, so I'm pretty happy with it.
So you're happy. One of my favorite moments in this episode was your mom interrogating Dr. Dubrow like he was a murderer.
I have some questions, doctor.
Yeah.
How long have you been doing this kind of surgery, and what school did you go to? How long is she going to be out? How long would it take her to get back to normal? And how many of this have you done?
So Desiree's mom was giving me the third degree. She scared me a little bit. Maybe she should have asked the surgeon in Mexico those questions, too.
Well, joining us now is Desiree's mom,
hello.
Carolyn. How are you?
Hi.
So tell us what you think of Desiree's surgery now, or what she looks like now.
I think she looks fantastic. I'm so happy about that, because that's the way I thought she was going to look the first time. And when it didn't come out that way, I was so upset.
You were the one who recommended this doctor in Tijuana to her in the first place. Why?
Because a friend of mine had went over there, and had some surgery done. It wasn't a tummy tuck, it was another kind. And it came out fine.
Same doctor?
Same doctor.
Did they use ice on them too?
I have no idea about that.
So now, were you mad at your mom?
I was never mad at her. I mean, it was still, in the end, my choice.
Gosh,
she
the
went
plot
with
gets
me to
even
the
thicker.
consultation. I felt really confident, and, you know, I was like, yeah, I'll do it.
What a bonkers storyline we're experiencing here on this day.
But it was just weird afterwards when she didn't come to me with the surgery.
I would have went if I had any inkling it would have turned out that way. I was livid. I was so upset. I was so, oh my God. She looked horrible. She had this blood coming out of her. She was bent over. She was so hurting so bad. I kept saying, what did the doctors say? Everything was written in Spanish.
That's what you get when you go to Tijuana, my friends. Terry, how did it feel to be cross-examined?
It's scary.
Yeah, everything was written in Spanish. Yes, because you're in Mexico. I do feel like, okay, there's not, what can I say here? How am I going to say this? Let me redirect the conversation to an interesting phenomenon that happens with, I'm going to say mostly American tourists, shall we say. So in the UK, we have like lines when you come into the country where you have like local people and you have foreigners, and they get divided into different lines with different passports, blah, blah, blah. A recent phenomenon that's had to happen is under foreigners, they have to also put in brackets United States citizens, because United States citizens, when they travel abroad, often don't connect that they are a foreigner at that moment. It's almost like this political rhetoric of like us versus them, foreigners coming in, you know, like immigrants, blah, blah, blah. When you leave your country, you are a migrant, you are an immigrant, you are a foreigner at that point. So when you try to come into the UK and you see like passports welcome everyone and then passports foreigners, and you think that that doesn't apply to you, that's the same kind of attitude that leads into this, well, I went for surgery in Mexico and everything was written in Spanish. Like, to me, that's straight up obvious. It's obvious that that's going to happen. No? Is that not obvious to other people? It's not everyone, don't forget. It's not everyone. It's not everyone. It's just interesting that it happens enough that we have to have signs about it.
I got to be honest with you. I mean, I was in the middle of surgery.
Well, a surgical consultation
not only am I facing
is an
this
interview.
incredibly difficult problem, I'm facing that out there, you know, so... But I don't blame you for doing that, and I was happy to answer your questions.
You really did.
And how does it feel now seeing your daughter so happy with her results after everything she's gone through?
It feels phenomenal. It really does. I'm really ecstatically happy because she feels good about herself.
Well, we will.
Well, that's the important part, isn't it? That's why we do all this. Yeah.
We are back with Dr. Terry
Is it Janice
DeBrow and
time
Dr.
already?
Paul Nassif
Everywhere you look, there she is, doing all that. What was the last episode we saw Janice Dickinson plastic surgery pogo stick?
And indeed it was.
Not the most obscene sentence we're probably going to hear today.
Union Show and Tell. I'm
Show
Maria
and
Menounos,
wig.
and joining us
Put
now
on your
is
wig
a
and show
larger than
it.
life television personality
Larger
and
than life.
entrepreneur. She is the Janice Dickinson.
So do they keep like
Janice may be
shuffling
the
around
world's
and bringing her
first
back in, or is
supermodel,
this like a
but
different
to
day?
Dr. DeBrow and Dr. Nassif, Janice was a super challenge.
Yes.
Let's take a look at the good, the bad, and the ugly.
Why is she back again? Why is she getting a double feature?
I wanted to have softer breasts. Sylvester Stallone paid for those, so I figured, why not? Free I'm in.
I'm just like
No, I know, but I can't walk around and hold my breasts
she
like
looks
that
so
all day
different
long.
out of the
I don't want
studio.
rock star. Wanted them to look appropriate for a woman my age.
Theoretically, we would take those implants out and then lift up your pectoralis major muscle, peeling it off the rib.
I don't take narcotics, but
You don't take any narcotics?
well, no, I'm sober. I'm really nervous about it. He said under the muscle.
You're gonna like take the meds as prescribed.
That's what I have. Under
I
the
know,
muscle.
exactly.
But as prescribed.
I like Janice, but she's a challenging
Not a
patient
free
for many
lapse, girly
reasons.
wig.
She doesn't give you exactly an accurate history. The other challenge will be managing her postoperative pain.
I'm in AA. Of course, I don't want a cocktail.
I love Janice when she's in a chemical coma. What I'm concerned about is when she wakes up. Where's
This
your
is
dress?
bonkers,
Who took your dressing off?
I did.
What is
Pulled her
this?
brains out,
The
didn't she?
drain from my boobs. You didn't tell me not to take it off.
Right, that's true. But I also didn't tell you, not to jump out of an airplane, but
No.
you're not going to do that either, right?
Oh my God! All right, enough.
In my 25 years of being a board-certified plastic surgeon, Janice is by far the most difficult patient I've ever had.
Oh my goodness. In your 25 years, you said as a plastic surgeon that Janice was by far the most difficult patient.
I believe it. I fully believe it. Do you believe it? I believe it.
What made Janice so difficult?
It was
She's
like
a very
the Janice
troubled
Dickinson
lady.
wild ride experience, you know. I
troubled
mean,
lady.
just we'd come to an agreement about what we were going to do post-operatively, and the next time I would see her, and things were completely different than what we discussed, you
Was
know.
that because she was nervous, though? And was getting anxiety? Yeah, right?
Well, taking your drains off and tying them
Yeah,
in a
that's-
knot. Janice is the kind of person you might put in handcuffs post-operatively.
Yeah, that,
Put her
like,
under
anxiety doesn't make you rip a drain out. Something else does.
anesthesia for 2 weeks.
You
and then
might
wake
like
her
it,
up.
Terry.
Oh, my God. Well, you also said that you never knew what you were going to get with her. Were you going to get good Janice or bad Janice?
Right. It was-
What are the differences between the Janices?
Well,
I mean,
the good Janice, the
realistically, what's actually happening here is that Janice is in recovery from being a problem. Well, yes, but also having a problem addiction, shall we say, to illicit substances. So I think Janice can be held responsible for what she says and does to other people. However, I think in situations like this where plastic surgery and medicine are involved, doesn't excuse the behavior, it explains it.
The good Janice, the Janice we're seeing now, she's amazing, she's intelligent, she's gorgeous. Bad Janice is the Janice you saw on the show where she's out of control. And crazy, and pulling at her drains and touching her incisions and going through all sorts of crazy emotional states.
Bad kitty.
Yeah.
And, you know, obviously you talked about
Got
your
to have a
history
hobby.
with drug abuse on the
Yes.
show. Tell us a little bit about that.
Well, it's
Oh,
very
here we go.
important for me to be upfront with everyone about my personal life, and I have to be straight up with my doctors to say, you know, look out, because I have had a problem in the past with narcotics. That would be sleeping pills.
But how long were you sober before you went in for the surgery?
A few years.
Okay, so
Yes.
were you nervous to go in and do this?
Oh, yes, absolutely, especially after I had it done. And the first night of recovery, thank God for you that my fiance, Dr. Gerner, was there, Rocky.
Yeah.
And I changed, like I snapped as soon as I had whatever you put me out with. What was it? What, morphine?
Dilaudid.
Well, anyway, I had a real effect in the hospital.
I want to ask Dr. Nassif, how hard is it?
They cut that conversation short because I actually feel like that's a very important conversation to be having in such a public space about like what recovery actually looks like. Because to people who've never had a problem with illicit substances, to just like stop taking it, don't think about it, move on. It's not as simple as that. And actually the road to recovery is a road. And when you're driving down a dirty country road that's like lumpy and bumpy and there's twists and turns and ups and downs, it's not like a nice motorway where it's just A to B, done. It's a bit more convoluted and complicated than that. So it's very interesting that she's talking about her experience and it seems to have been like cut short, because I, for one, would have liked to hear more about that. I don't know. Is a botched plastic surgery show the right avenue for that? I'm not sure. Reality TV would have really helped Janice had it have like documented her recovery, perhaps, rather than it sort of almost heavily leaning into the fact that she's a problematic person.
To manage post-surgery with someone who has had a history
how
of
do you manage
drug
it?
abuse.
Sometimes when they recover and they have pain, that might say, you know what, I want nothing except Tylenol. But other times, just, you know, what happened to Janice, for example, you get into a stage where you need a lot of pain meds, and your tolerance level is, you know, the threshold is just a little bit might cause a problem.
You said in the show that you wanted them to do your badge when you were like, oh, well, while you're at it was something like that. While you're at it, do my
Not
badge.
the DV.
Did I say that to
Designer
you?
While you're there,
Vagini.
do something to my badge.
No way.
Yes. I said, we'll leave that up to your fiance.
That's when I was like, you know, just a little wobbly in my head.
Yeah.
You know, so that's all I have to say about that. So it's so. Well, I'm
mean, that's
still
not
sober.
funny.
You know, I'm still
Yeah,
sober,
you've
and
done
I
great.
have really no recollection of that. I see it now on camera, and I am shocked and appalled. But you know, that's the beauty of Botched.
It's real.
So you really don't remember?
I promise you, I don't.
Wow.
That is, do you know what? As it might sound very far-fetched to people who don't have a problem with addiction, especially to something like sleeping pills. I had a very tumultuous relationship verging on addiction to something in a similar sort of vein to sleeping pills, anti-anxiety meds, and they erase your memory in a very troublesome way. if you've ever got blackout drunk and you really can't remember what you did the night before, but you've got that horrible hangxiety, as it's called, that feeling would happen fast, and you'd only have to take maybe twice your recommended dose, maybe 3 times if you're a heavy user of sleeping pills to get to that level of a blackout blind drunk. And you can just do that in a handful. And that could be every day. You could be losing weeks of your life from behaving like this. So I actually really believe Janice here, where she says, I do not remember that specific moment. I don't quite feel the same when she's on like America's Next Top Model or her modeling agency show, where she was perpetually awful every single day for the entirety of filming or whatever that is. But we saw her be very different in her recovery on this show from plastic surgery. And I can see that kind of motion where she's a little bit like this, the eyes are a little bit glazed over. That was my life, and I will never touch another one. In fact, actually, when I go in for plastic surgery, I always say, don't give me sleeping medication. I don't want to invite that hideous creature back into my life. Absolutely not.
Obviously, we're commenting on your 30-year-old implants. Why did you wait so long?
Wild to me.
I'm a busy woman. 2 kids, school,
in the business week.
TV shows, modeling, fashion shows.
Time just flies.
Time flies when you're having gravity in your breast drop.
Well, let's remind
Maybe she also didn't know. Did they even tell anyone back then?
Drops look like. The 30-year-old implants look like this.
I can't even look at this. How could you even show this?
So my mum had breast augmentation, and actually hers were like 20 years old, I think, when she... No, they were longer. They were more than that. They must have been much have been like 30 years old or something. And when she passed away, and I remember the doctors being shocked that she hadn't had them replaced. But I remember someone saying about my mum to me that no one ever used to say that your implants had to be replaced. Isn't that wild? Isn't that wild?
Stuff on TV, oh my God.
Kind of amazing. Like, what a difference.
It is amazing.
And they look so beautiful now. You did a great job.
Thank you. Yeah.
What's the average shelf life of a pair of implants? I mean, when are you supposed to replace them by?
Those older ones, no offense.
You said old again!
Well, those...
Antiquated!
Those antiquated ones from back then, they have a very high rupture rate of about 78% after about 10, 15 years. So those should all have been replaced by now. The newer ones, theoretically, can go on indefinitely.
I'm done with surgery. I just want to work in your office, and I want to help women become better.
Yeah, you don't need any more surgery. I think you are done.
Thank you.
Apart from the occasional filler,
what
right?
What about fillers? Speaking of fillers, I could use a little bump, Doc.
I actually have Sculptra in my medical bag. I mean, if you want it, I can.
I would love to do it and show the world.
Of course. So are you ready for Dr. Dubrow to stick it to you?
Stick it to me, Terry.
That was not me.
Stick it to me, Terry.
I'm ready to stick it to you.
I do as I'm told.
So wrong.
Okay, so Terry, tell me a little bit about this injection you're going to do.
So we're going to inject Sculptra, which is a filler material that when injected under the skin...
Oh, no, sorry. They must have organised this beforehand, surely. They can't just have gone on TV and been like, do you fancy having some Sculptra? Yeah, sure, why not? Like, okay, right. So we're going to hear about Sculptra. Now, Sculptra is a very interesting filler because it is a long-lasting filler, much longer lasting than a hyaluronic acid-based filler like Juvederm or Restylane.
That when injected under the skin causes the skin to grow its own collagen and fill out the area.
Really works, huh?
Yeah, and sometimes when we're very thin like this, as we age, we lose the
Like this, like I don't exist, like I'm an inanimate object. Are you out of your mind?
Anyway.
But you know, instead of using a regular filler, this is actually like twofold. It does the job and it helps encourage collagen growth. That's smart.
You grow your own tissue in response to it. So,
okay, so
really
how often does she need to do this?
She needs to do it 3 times. This is her 3rd time. We've done it twice before.
It's my second. You're out of your mind.
You forgot the first one. Just like the original surgery we did together. You forgot all about it. You
might be right.
Sorry. Yeah, this is your 3rd. So anyway, it's worked nicely. It is filling out her temple areas nicely.
Well, because this like caves in after a while?
She was very hollowed in this area now.
That's because I'm 90 years old. That's why.
You're not 90.
And we lose mid-facial volume as we get a little bit older and thin.
Do you have it in you?
I actually have had Sculptra injected in my face.
Where?
Interesting.
I recently lost 22 pounds. I did. And it made me very hollow in here, and I had a little bit of it injected.
Really?
Yeah.
What happens if he gains the weight back?
Ouch.
Then he's going to have...
Then my face, like your breasts, will be very large.
Oh, my God.
God, it's that tit for tat, isn't it,
Did you
girly
do it
wigs?
yourself?
Tit for
I did do it myself.
You did? Like, how do you look at it very
well? When
objectively?
when you do this for a living, even though it's sort of right, left, weird in the mirror, right? You get used to doing it that way.
Do you do things to yourself?
He does.
Oh, yeah, I do Botox. I mean, because you're standing there in front of the mirror and you just kind of go boom.
Why don't you
pop,
guys
and
just
can do
hook
it.
each other up and take care of each other?
Well, hook up another
Get a room.
Well, I can't wait to see what you're going to do to Janice.
Interesting.
Yes, please.
Okay, so should we do it?
I'm not sure how I feel about that. I mean, we all know that injectable practitioners kind of do their own, but to go on TV as doctors and say, yeah, we do our own, that's a bit different to me. Bit different. Mind you, it's one of these things where I'm like, do I prefer it to be like an open secret, or do I prefer people to be upfront about something? Difficult, isn't it? Because if it's about transphobia, for example, I would rather someone be very open about it than be sneaky.
Yeah.
All right, so we're going to bring you the chair.
Can I be
Right,
the
let's
assistant?
have, okay, let's watch some Sculptra.
Interesting.
Let's
How
learn
long do
about
you
all
guys
this.
scrub your hands before surgery?
This is not the outfit.
5 solid minutes
Yeah.
to
Correct
cheat.
cheat.
No.
What if she falls out of that
Never.
seat?
Okay.
So what?
So let's pull your hair back just a little bit so we can show the
Doesn't she
temples,
need-
maybe behind your ear.
Yeah,
Yay.
doesn't she need to have-
So I'm going to first put some numbing medicine in because this does use, a Sculptra uses a very large needle. We're going to inject it right in this area. First, don't move, ready? A little numbing. This is going to hurt a little bit. See, she's actually a great, look at her. She's a great fit. This hurts. Look how tough she is. This is the numbing medicine right there. See that?
Looks like an edamame.
Wow, that is edamame.
It's edamame.
Is that going to go down? Like soon?
Yeah.
So now, is this filler better to use than other fillers in general throughout the face?
Remember, this is not a filler.
Oh.
This is actually more of a biostimulant, it's called.
Oh, okay.
So as soon as it goes in, the next couple hours,
it's a
it
bit
will just,
different.
dissolve. It will stay in there, but you're not going to see like an actual fill.
So the goal of this is just to rebuild the collagen underneath.
Yes, this is better than filler.
really good.
You don't actually see the final result now. It takes a few weeks to actually grow in.
Interesting.
But this is her final treatment.
Do you feel it?
I do not feel it. I just
don't?
feel like something good going in.
It
Well,
lasts
that's the
5
numbness,
years.
though.
Regular
That was-
filler only lasts a few months. So here's the needle.
that's a big needle.
Here's a big
Okay,
needle.
I'm not going to
It's
look.
a big
I'm
needle.
going to not look.
Yeah,
Do
don't
it
look.
again.
Horse
Just
tranquilizer.
Take your finger and just push in here. Sometimes
So watch
that
this.
actually
You
helps.
inject
Really?
this very
You're trying to get
deeply.
sexy
Check
with
this
me.
out. Check this out.
The audience going,
I know, it hurts,
gasp!
doesn't it?
Oh
my God,
my
that hurts.
God!
Oh, no, actually, it's okay.
Right? Well, now
that
it's
is a
all
lot.
numbing medicine that's
Holy
going in
moly,
with it.
Batman.
That's an interesting technique.
It's
It's
like
called
you're,
the threading technique.
like
You do
you're-
it very deep.
it's like you're masturbating my temple.
Excuse me.
Well, look at
Jesus.
it. Very
Okay.
strange.
There.
That-
That's- Put a
I
little
should
pressure
put my
there.
hands here, okay?
She is absolutely gobsmacked that she's had that done on TV, and I can agree, because you surely should be laying back in full comfort for that. That, I have never seen that happen before. I've had cannulas under here for under eye filler, which is a dramatic thing, but also quite nice, actually. It feels a little bit violating at first, but then the overall effect at the end of it is quite pleasant. The idea of like a needle this long, about this long, going into here, I'm not going to be able to possibly ever show that on YouTube, but it was like going into here and going like up and along. Like, I don't know, it just feels like I don't have enough there for it to be doing all that.
God, how awful!
It doesn't hurt. I'm amazed that it doesn't hurt.
Okay, so we'll numb up the other side.
It hurts in the way that's like, you know, something's being done, but it's
You're
not.
my assistant. I need you here for moral
viscerally
support.
painful.
Maria, I need you.
See, look how she's actually an amazing patient. You would think after that craziness
baby in
with
the
her
audience
breast that
going,
she
"God!"
would be different, but she's incredible. Okay, so that's the numbing that allows me to put the big needle in, and here's the rest of it.
Oh, there goes my brain. Oh my God.
Right.
I see lights.
By the way, if you wake up tomorrow and you can't move, give me a call.
Oh, my Lord.
You know what? That'll be the day.
Okay, push here.
Okay.
That's it.
Fascinating.
That's
Yeah.
Sculptra.
Where is the place that women lose their collagen the most?
Initially here in the temples, right? And then underneath the cheeks, and then along the jawline.
Do I
So
need
is
any of
that
that?
Which
the
is why
places where
buccal
you
fat
should be
removal
injecting this?
is
Yeah, I mean,
an incredibly aging process. Looks great when you're young and you can have, but when you're 50 and you have absolutely nothing here, no volume here at all, it's a problem.
But you don't want to see as a skeletonization of the face where you start to see the facial
You want
skeleton. You look at
definition,
your face, you're really nice
but not
and wide
like-
out
She's
here.
19 years old.
I know, but as one ages, you start to become hollow in here. You
Yeah.
can see the skeletal structure of the skull, and that's not
Got
attractive.
it.
And
Okay.
you lose the facial
Kind of good for a
proportion.
supermodel, though.
Right?
Well,
Let me
you've
see.
been a great patient,
Thank
Janice.
you.
Thank you so much for sharing this with us and for being with us.
Thank you so
So
much.
that was obviously like pre-planned. That wasn't just, let's have some sculpture, girl.
Oh my goodness. Oh my goodness.
Okay.
His wife must be like...
She just humped you. Oh my God, look at your face. All right.
I've been violated.
Coming up, it's a special sneak preview of what's coming up on season 2.
Look how embarrassed he is. That Janice is something else, isn't she? Right, what's in this last, minute of this
season
show?
2 of Botched is already in the works. What are you guys looking forward to most in the next season?
Actually, what am I looking forward to?
Yes.
Working with my good friend here and having fun. I miss him.
And you know what? I'm looking forward to helping people who
And they're
really
still going now,
need
aren't
our
they?
help.
Even
Do you think you can put
later.
up with his mean-spirited comments towards you for another season?
I love
Let's pick up like a brother that he never had.
Yeah.
It's all love.
All right, well, there apparently were a lot of you out there who want your botched plastic surgery fixed. We actually received over 4,000 submissions for season 2 of Botched, and we've been combing through the cases to determine who will consult with the doctors next season. Well, if you want to have the opportunity of a lifetime and consult with Dr. Terry Dubrow or Dr. Paul Nassif about fixing your botched surgery, send an email to botched@evolutionusa.com. And before we go, let's bring out all the botched patients who visited with us.
Let the music play. Oh, we were going to do an awkward dance.
So much energy. I love it. Dr. Dubrow, Dr. Nassif, thank you guys so much for being with us
like the
today.
ending of the
Thank
Swan
you to all
pageant.
of our former patients. And thank you guys for joining us for the Botched Reunion Show and Tell. Don't forget to tune in for season 2 of Botched, airing early
And
next
stroke
year.
your
on E! Say
banister.
goodbye,
Why is Monique over there by herself? Be nice to Monique. She's got measuring spoons on the bottom of her dress. Well, that was absolutely batshit bonkers insane, wasn't it, my lovelies? So, I've got some thoughts. So this one was kind of full of more salacious, shocking reunion gossip than the first episode. I sort of didn't really expect to be having some of these conversations that we've had today. Botched is a very interesting show because it kind of ears on that reaction of a reaction, if that makes sense. Like, I'm reacting to something that they're reacting to that already happened 10 years ago.
She time travels and she's a medium.
And it's very interesting to see where these people are now and what we're going to be seeing in season 2, because at the end of the day, it kind of really does boil down to be really careful and sensible about who you choose to do your plastic surgery, because complications can still happen with the best of the best. Well, my lovelies, let me know what you think about what we've seen in today's video, because that was a lot, wasn't it? That was a lot. It's always a lot, but this was extra. And with that, my loves, it's time for the Patreons. You can see yourself scrolling past on the screen right here. Today's Luxeria Labs subscriber shout out goes to Jolene. Thank you so much for subscribing to my second channel here on YouTube, Luxeria Labs. That is my tech, travel, and photography channel here on YouTube, my lovely. If you want to be in with a chance of being featured in my next video's subscriber shout out, make sure you go over and subscribe to that channel. It is pinned in the comments below. And as always, I want to say a massive thank you to my top tier Patreons: Orkos Samoji, Amelia Dillingham, Ari Ardia X, Asgardians, Becky Johnson, Beebles32, Bumblebee Whisperer, Cameron Pittman, Shell Herman, ContraPoints, Finch Dunham, James A. Zengirl, Jenny Wood, Larissa Says Relax, Leanne Jones, Lenore, Les Banana, Marzipan, Mo Sherman, Miss Kiss, Novembrix, Paula Rivera, Sky Dorim, Steph Utek, TNS Mum, and Taylor Martin. And you know what, my loves? I think I'm going to leave it on the notes of just don't do it. Don't do any of all these.
Who wants the cake? Cake.
I'm all dressed up.
Cake?
I'm all dressed up.
Do you want the cake?
Lonely Up a doom.
Up a doon.